Hello, everybody. So we are in medical terminology number five. So primary hyperparathyroidism, increase in parathyroid hormone, parathyroid adenoma, or hyperplasia, which will increase in the parathyroid hormone. Secondary hyperparathyroidism, reduced calcium level and or increased phosphate level lead to parathyroid hyperplasia, increased parathyroid hormone, and I think this is alkaline phosphate. Okay. Vascular disease in diabetes mellitus, non-enzymatic glycation of proteins, small vessel hyaline arteriosclerosis, large vessel atherosclerosis. Diabetic ketoacidosis, reduced insulin or increased insulin requirement, lead to increased lipolysis, breakdown of lipids, increased free fatty acid oxidation, and increased ketogenesis. Hyperosmolar hyperglycemic state, hyperglycemia, lead to increased serum osmolarity, excessive osmotic diuresis. Zollinger-Ellison syndrome, gastrinoma in the pancreas or duodenum, recurrent ulcers in duodenum, jejunum, and malabsorption. Duodenal atresia is recanalization failure. This is the cause. Recanalization failure. Jejunal or ileal atresia, disruption of mesenteric vessels, most commonly superior mesenteric artery, lead to ischemic necrosis of fetal intestine. Superior mesenteric artery syndrome, diminished mesenteric fat, lead to compression of the transverse or the third portion of the duodenum by the superior mesenteric artery and aorta. Achalasia, degeneration of inhibitory neurons in mesenteric plexus of esophageal wall, lead to failure of lower esophageal sphincter relaxation. Barrett esophagus, chronic GERD, gastroesophageal reflux disease, lead to metaplasia of non-keratinized stratified squamous epithelium, which will be changed to intestinal epithelium, which is non-ciliated columnar with goblet cells. Acute gastritis secondary to NSAIDs, non-steroidal anti-inflammatory use, lead to reduced prostaglandin E2, which will lead to reduced gastric mucosa protection and maybe gastric ulcer might happen. Celiac disease is autoimmune mediated intolerance of gluten, which is found in wheat, malabsorption, distal duodenum, proximal jejunum, and associated with steatorrhea, which is excessive fat in stools. Fistula formation in Crohn's disease because of transmural inflammation. Meckel diverticulum, persistence of the vitelline or omphallomesenteric duct. Hirschsprung disease, loss of function mutation in RIT, failure of neural crest migration, lack of ganglion cell enteric nervous plexus in distal colon. Adenoma carcinoma sequence in colorectal cancer, loss of antigen presenting cells, reduced intercellular adhesion and increased proliferation, KRAS mutation, unregulated intracellular signaling, loss of tumor suppressor gene TP53 and DCC. So this is the sequence, adenoma to carcinoma sequence, how this happens. Fibrosis in cirrhosis occurs via satellite cell production of extracellular matrix. Rey syndrome, aspirin, this is in children, aspirin reduce beta oxidation via reversible inhibition of mitochondrial enzymes. Hepatic encephalopathy, cirrhosis, lead to portosystemic shunts, reduced, think this is ammonia in H3 metabolism. Alpha 1 antitrypsin deficiency will affect the liver, lead to misfolded proteins aggregate in hepatocellular, extracellular or endoplasmic reticulum, lead to cirrhosis, and in the lungs will lead to reduced alpha 1 antitrypsin, lead to uninhibited elastase in alveoli, lead to pan-acinar emphysema. So it will affect the liver and the lung as well. Okay. Wilson disease, mutated hepatocyte Cooper transporting ATPase, ATP7B on chromosome number 13, lead to reduced Cooper incorporation into apoceroblasmin, reduced biliary excretion, reduced serum ceroblasmin, increased Cooper in tissue and urine. Hemochromatosis, HFE mutation on chromosome number 6, reduced hepcidin production, increased intestinal absorption, increased iron overload, increased ferritin, increased iron, and reduced TIBC, and lead to increased transferrin saturation. Gallstone ileus, fistula between gallbladder and GI tract, stone enters GI lumen, obstruction of ileocecal valve narrowest point. Acute cholangitis, biliary tree obstruction, lead to stasis and bacterial overgrowth. Thank you and see you in the next one.